We all have cell phones, and you know how sometimes our messages get messed up. Well, something similar like that happens in spinal muscular atrophy or SMA. Hey guys, in today's video, let's learn about spinal muscular atrophy. Assume your brain is a phone company delivering commands to your muscles to move. SMA has a problem with its messengers. These messengers are unique nerve cells known as motor neurons, and some of them are missing or malfunctioning in SMA. As a result, your brain's messages are less effective. This causes the muscles to weaken and thin out, atrophy. Hence, the name spinal muscular atrophy. It's as if your muscles have forgotten how to move since they haven't received precise instructions from the brain in a while. So what exactly causes SMA? The survival motor neuron gene 1, SMN1, is responsible for the most common kind of SMA. It may be mutated or missing. The survivor motor neuron, SMN protein, generated by the SMN1 gene on chromosome 5q, helps motor neurons stay healthy and operate properly. People with SMA have insufficient levels of SMN protein, which causes motor neurons in the spinal cord to die, as well as skeletal muscle weakness and atrophy. The upper limbs, arms, and trunk, chest muscles are frequently weaker than the hands and feet. Babies with SMA type 1 may never be able to sit up by themselves and may struggle to breathe. Other kinds of SMA may not develop until adolescence or perhaps adulthood. People with milder forms of SMA may experience difficulty walking, climbing stairs, or lifting goods. There is no cure for SMA, but there are treatments that can help with the symptoms and quality of life. These therapies include physical therapy, occupational therapy, and medicine. Newer treatments such as gene therapy are also being investigated. Spinal muscular atrophy with respiratory distress, SMARD, sometimes called autosomal recessive distal spinal muscular atrophy, the SMA1, is a rare form of SMA caused by IGH-MBP2 gene mutations. Infants with SMARD have severe respiratory distress as well as muscle weakness. There is a substantial risk of intrauterine growth restriction and premature birth. Distal SMA has been related with a wide range of genetic causes, each with its own set of symptoms and severity. UBA1, DYNC1H1, TRPV4, PLEKHG5, GARS, and FBXO38 are among the genes associated with various kinds of distal SMA. Some of these SMA variations are linked to Charcot-Marie-Tooth disease, CMT. The intensity of motor versus sensory symptoms observed in the patients typically determines the diagnosis. Spinal muscular atrophy is a progressive disease, meaning the muscle weakness and wasting worsens over time. However, the rate of progression varies significantly depending on the type of SMA. SMA type 0, the most severe form, has the fastest progression. Onset is usually before birth or within the first month of life, and infants may not survive past their second birthday without breathing support. SMA type 1, this severe form starts in infancy within 6 months with rapid muscle weakness. Without intervention, children with SMA type 1 may not reach age 2 due to breathing difficulties. SMA type 2. Onset occurs between 6 to 18 months. While progressive, this type is less severe than type 0 and 1. Individuals may achieve some milestones like sitting, but face challenges with breathing and independent mobility as the disease progresses. Lifespan can vary, but is often between 20 to 40 years. SMA type 3 appears in children 18 months or older, even reaching teenage years. Muscle weakness is present, but most can walk for a while, especially early on. Progression is slower than type 0s to 2, and lifespan is typically not affected. SMA4 develops in adulthood after 21 years old. This is the mildest form of slow progression and usually doesn't impact lifespan. Symptoms include mild to moderate weakness, particularly in the legs. While all known forms of SMA are hereditary, they are caused by different gene abnormalities, have separate inheritance patterns, and have different implications for family planning. If you or your child has been diagnosed with non-chromosome 5-related SMA, consult your doctor and a genetic counselor to learn more about the genetics and prognosis of the specific type of SMA. That's all for today, folks. Subscribe to our channel and check the links within the description to learn more about SMA.